You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says no more dentures. With us, we have an expert on the topic, oral and maxillofacial surgeon, Dr. Gary Schwarz. Dr. Schwarz, welcome to the program.
Thank you, Randy. It's good to be here. Thank you for having me.
Now, you brought a lot of photos, so we'll get to as many as we can. But for people that don't know you or your practice, who's your typical patient and what are the different procedures you do?
Well, Randy, I've got a full scope oral and maxillofacial surgery practice, which includes everything from jaw surgery to joint surgery, reconstructive facial surgery, wisdom teeth. But my real passion is in the area of helping people with dental implants. And in particular, there are these two situations where people are in a true crisis mode, where they're panicking. And that is the patient who's lost or is losing a front tooth in the aesthetic zone. Randy, I don't care if you're a banker or a teacher or a truck driver. That's a crisis. Yeah. People have some pride about them, and to walk around with a black hole in the front of their mouth or to have to wait forever to get it fixed, that's exciting to help that problem.
And that's what you do all the time?
I do that all the time, but my real joy is applying that same thing to people who have either lost all their teeth or are facing losing all of their teeth, and they're in a panic about it. So being able to help them quickly, comfortably, efficiently, predictably, that's exciting. It gets me fired up.
Good. So no more dentures, we said at the top of the show. You don't like dentures.
Well, I don't like them.
You don't think anybody should be wearing them?
No, I mean, why would I like them? Patients hate them. You know, they tolerate them only when they don't realize they can get it fixed. So no, I don't like dentures. I mean, I would cure the world of dentures if I could.
Is it an exaggeration when people say things like that they could walk into Dr. Schwartz's office with no teeth on the day of the procedure and walk out with a full arch of teeth fixed in their mouth?
Absolutely. I mean, with some planning, obviously.
Yeah.
I mean, I can do that single tooth, bam, without having even seen them before, but not the full arch, because we got to do some planning, we got to prepare for it. But once we're there for the day of the procedure, you bet you, they walk in without any teeth or with their existing bad teeth, which are then removed, and they walk out with fixed teeth on the implants, nothing removable.
So you're an oral surgeon, so you work with the general dentist in town?
Yes, sir.
A team approach?
Absolutely. Absolutely, and you know, I believe in working with people that are responsible in the area of continuing education, in the area of standing behind their work, communicate well with the specialist, and I'm blessed with a large group of fantastic dentists in my area that come to a study club. I've got one of the largest study clubs in the country, and so it's a real blessing working not only with the patients, but with these fine dentists as well.
Now you teach dentists, specialists on how to do dental implants. I mean, the things we're going to talk about today, you teach, you lecture on the road?
Yes. Nobel Biocare is the largest implant maker in the world, and they're the system I've always been loyal to, and they've had me lecturing for them for the past 6 or 7 years.
So you're teaching the dentists or the oral surgeons or
how to do the all-on-4 technique.
All on the same day.
And other procedures as well, all on the same day.
Now, does it cost more to go to an oral surgeon, right? I mean, because you're the guys with the training, right?
Yes.
In and around the bone and all that stuff.
Yes. I don't, in my opinion, I mean, no, because, you know, because of the volume that I'm able to do, I'm able to buy implants at a cheaper price than someone who doesn't do that many. You make fewer mistakes, require less bone grafting because of your experience and whatnot. I don't think so.
Okay, so with dental implants, just for a moment. Now, when we talked about what you could do for the denture wearers, are there a lot of denture wearers where you are?
Oh, my goodness. Randy, first off, in the U.S., it's estimated there are 40 million denture wearers, complete denture wearers. Now, you know, I'm from Texas.
Yeah.
And in Texas, everything's big, right?
Okay.
Or at least we think it is. You know, we're typical exaggerators. But it's no exaggeration to say that Dallas Cowboys Stadium, who used to be America's team, some would argue with that now, but that new stadium, Jerry Jones's new stadium, AT&T Stadium, it's a huge stadium. But I'll guarantee you, if you take that number of denture wearers and you apply it to a 100-mile radius around my office in southern Texas, which would draw also from northern Mexico, I'll guarantee you we could fill that stadium with people who have dentures in their mouths that are suffering. And if on top of that, we take the people who are headed there.
Headed to dentures.
Yes, sir. Because of all the things that are causing that to happen, we could fill that thing 10 times over. I could do that procedure to restore their mouths every day from morning till dark for the rest of my life and not even scratch the surface.
Well, if it's so good, look, if getting rid of your loose-fitting denture and getting it anchored, I guess, to dental implant is so good, why aren't they all doing it? What's your take?
You know, that's a great question, fantastic question, because it gets at the heart of the matter to understand people and what's causing them not to get helped. And I think there's 5 or 6 reasons, Randy. I think to start with, so many people that end up in dentures, they're out of the system. You know, and they have spent their lifetime in dentistry. You know, obviously they had to get them pulled, and before that, most of them tried to get them worked on. And they have memories of pain and money and issues that they went through. And it's almost like a relief when they finally get all those teeth out and they get into dentures. Now they hate them and they don't realize there's something better that they really could in many cases afford, but they just don't know. And so the first thing is they're out of the system and they just don't realize what can be done. That's number one. Mm-hmm. Number two, there's a large number of them that have bitter memories of what being in the system was like.
So they're afraid of you guys.
Well, there's fear, there was the pain, there's all the money they
Nobody
spent.
likes going to the dentist, right?
No.
Especially the oral surgeon. Now they know they're in trouble, right?
Yeah, that's right. But, so many of them, it's almost like, oh, finally those teeth are out. I don't have to spend any money on them anymore. Okay. And so they just try to make the best of a bad situation and try to stay out of that dental office. They may go back for periodic adjustments and sore spots and things like that. And the dentist who they're seeing may not even know what can be done and doesn't educate that patient on what can be done. I'll give you a good example.
All right.
2 weeks ago, I was teaching a course at a conference. We have a Dentist Who Care conference in South Texas where we raise funds for the indigent and we provide continuing education. And I was one of the programs, and I spoke on how to build this full arch of permanent teeth all in one day. There were about 70 dentists that were there from my area. Only less than 10 of them had done this procedure, and they were there to learn more about it. So we're trying to make a difference. We're trying to teach it and get the word out more. But so there's lack of understanding from these patients, if they're in a dentist office like that it can be done.
But isn't it true? But isn't it true that if you've been in a denture for like 30 years, you don't have enough bone to do this?
Well, absolutely, and that's another reason. You just hit on one of the six. Lack of bone. So many patients.
Well, is it true or not true?
No, it's yeah. Let me qualify it. It depends on the experience of the surgeon you're seeing. Dr. Malo from Portugal, who invented the all-on-4 concept, which is a concept of being able to replace the whole set of teeth permanent on just 4 implants, which is part of the magic of this technique because it makes it affordable now. Before he did that, I mean, I used to think, as many of us did, that we needed at least 8 implants in the upper jaw and 6 to 7 in the lower jaw to do this. And then Dr. Malo comes along and Nobel Biocare with this all-on-4 concept. At first, I didn't believe it. I was thinking, this is too risky. It's not enough implants. And I was lecturing on our technique with more implants. And one of the criticisms was, how can you be credible if you haven't even tried the other? And I realized I needed to. And you know what? When I did, I was blown away. It's an incredible technique.
So a full arch of teeth on just 4 implants? Just
4 implants. But back to your question about bone. Dr. Malo said he hasn't seen a case he couldn't help once his war chest of techniques was expanded to everything that you can do to deal with lack of bone. And that's the case for me as well. I've yet to see one case that I wasn't able to do. And I haven't done as many as Dr. Malo, but I'm catching up. Another reason these denture wearers aren't coming in, Randy, is so many of them don't think they can afford it because their ideas of what it's going to take are not realistic. For example, a lot of people think you got to have an implant for every tooth. And they hear an implant can cost a couple $1,000s a piece or so, and they do the math, they think, I can't afford that. And they don't realize we can do it with just 4. But then there are those patients who do have the money, but they don't have the teaching inside their head to make them realize what this can do to transform their lives.
I mean, you say that you're transforming people's lives. You believe that?
Absolutely.
That's a big. No doubt. One day you say their whole life is transformed.
No doubt. Yeah. I mean, let me give you an illustration, an example of a real person. Unfortunately, I don't have pictures of her, so I'm going to have to paint for you the picture of what happened that day in your mind as I take you through it. So I get a call from one of the very best dentists that I work with, and he said, Gary, I'm sending you a lady, and when you look at her, you're going to think, you're not going to have a high opinion of her right at first because her mouth is so bad. But this lady's highly educated. There's plenty of funds there. But she is scared to death. You know, Randy, if I'm a baby boomer. Okay. My wife and I remember growing up in a dental office with belt-driven handpiece and resharpenable needles. Now, you're too young to remember that, aren't you?
Yeah.
It was horrible. Horrible. So if you're like my wife and I were, I mean, you had a phobia. I had a horrible phobia until I found a good dentist that could help me and not hurt me when I was older as a teenager, you know, and it rehabilitated me. But a lot of these people have never been rehabilitated. And this lady was like that. I mean, Randy, I've got a special forces patient who chased down the bad guys in the Middle East, house to house. And he's petrified of dentists, petrified. So you have to understand those phobias are real, and they're no respecter of gender or toughness.
So with
or
this lady, I
courage.
mean, you deal with that. How do you deal with it?
So she comes in, and so I talk to her. First off, you've got to have compassion. A patient can tell if you don't relate to their fear. But if you do, like I can, because I was there, and you love on them, and you have then confidence that you can help them and not hurt them, and you just win them over with your compassion, your confidence, your conviction, and your care, and your love. And they feel it, and they believe you. They want to believe. So that day she comes, so when I looked at her, and I got her to open her mouth, I mean, we don't have the Blue Ridge Mountains in South Texas like they do in Kentucky, but she looked like someone from Deliverance. And she had just neglected her mouth, and it just broke my heart. And her husband been trying to get her to go to someone to get this fixed for so long. His teeth were nice, but hers were not. And finally, the pain and all the problems finally forced her to do something. And then her dentist told her about me and what we could do with teeth in a day. Take her bad teeth out, put 4 implants in, both arches, top and bottom. And
so
have
full
her walk
arch of
out,
teeth?
Absolutely, and have her walk out that day with a new set of teeth.
Now, she was sedated during this?
So the day of the surgery, like a few weeks later, she comes in, I sedate her deep enough to not remember what's happening, but light enough to continue breathing. So she's not asleep, but almost. So you've got the safety and the convenience of being able to do it in the office without the medical risk of general anesthesia. And so we finished the procedure, and I got done, and when she first became aware that it was over, and that she was okay, and that it hadn't hurt, Randy, she started crying. Now, she hadn't even seen herself yet. And she said, I can't believe I did it. I did it. I got through it, and it was wonderful, and I didn't feel any pain. And she's crying. And so we haven't shown her pictures yet. So we get her husband back. And I'll never forget that moment. It was a made-for-TV moment. I wish I'd had pictures of it. Oh. Hair standing on the back of my head. When he walked in, and she stood up, and she turned to face him, and she smiled, and he looked at her. He just broke down and started sobbing. She still hadn't seen herself yet.
Wow. And
now she's really crying, and then she sees herself in the mirror. Oh my gosh, Randy, unbelievable.
Do you get choked up a little bit?
Oh,
or your
of course. How
assistants
can you not? You can't. You have no heart if that doesn't move it. So then I saw her a few months later, and oh my goodness, she looked like she had been dressed to kill by a Santa Fe boutique. She had that turquoise and stainless steel jewelry on, and her hair was completely different.
So it's just what, her self-esteem is that much better?
Yes, absolutely. Her life had been transformed, and so had his. And it's like they're on a new honeymoon. I mean, you know what she told me? She said it's like that day was like the first day of the rest of my life. Unbelievable.
So it's more than just teeth.
Oh,
it's how you feel about yourself. And they could eat and chew, but do they have to be careful?
No,
when it's all done and they're healed up.
We tell them initially eat softer type foods, in the beginning, but they're eating right away.
Could they eat when they're healed up, they could eat an apple or like corn on the cob or a carrot?
Absolutely. Another one of my patients said, Doc, have you ever bitten into an apple and you're so happy when you bite into it, or for whatever reason your lips aren't together and the water shoots out of that apple and hits the mirror in front of you or somebody else? He said, I hadn't been able to do that since I lost all my teeth. But since I got these permanent teeth, I love splattering things with my apple.
That's nice.
And because when you bite down with a denture, you can't do it because it kicks the back down. He said, my wife, she used to like me to just nip her on the neck a little bit. Romance never quits, Randy. I mean, I don't care how old you get. If your heart's beating, you still have a desire for romance. And dentures are just
no more dentures.
Worse for that.
So no more dentures.
No more dentures.
Good. We're going to take a quick break. We're going to come back. Some of these photos, because these are like cosmetic makeovers, people without teeth and now they have teeth.
Absolutely.
You're watching The Wellness Hour. I'm Randy Alvarez, and we'll be right back.
When I say it's a life-changing experience, it was. I've even had some good-looking women hit up on me.
Now that Mother has her permanent teeth, we're able to go to different restaurants. She's able to enjoy better food and all the kinds of foods that she can possibly eat. There are no problems. And of course, we take a lot of family pictures now where she smiles comfortably, and that makes all of us really happy.
Today, I have my health back. I have self-esteem that I didn't have before, and my life is completely different. At the age of 75, I didn't think it was worth it, but now I know it is.
Dr. Gary said he could fix my problem with implants. And you know what? The man did. I walked out of his office with teeth in my mouth, which has changed my entire life. I can now eat foods I couldn't before, like apples, corn on the cob. I could smile real big, and my teeth not fall out.
I have a very dry mouth, and last year it became a problem and started to destroy my teeth. I was so frightened and so afraid that I was going to wind up with dentures. Just the thought of having to pull them out at night scared me to death. I came to see Dr. Schwarz, and in one day, and without any pain, he restored my smile. Now that I've had the all-on-4 procedure, my life is back to normal. I'm so happy. I can smile without having to cover my face. I can eat whatever I want, and I can kiss my grandchildren. And best of all, I don't have to take my teeth out at night. Thank you, Dr. Schwarz. My husband loves my smile now. As a matter of fact, I think he might even be getting a little bit jealous.
You're watching The Wellness Hour. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My guest here is board-certified oral and maxillofacial surgeon, Dr. Gary Schwarz. Dr. Schwarz, welcome back to the program. You say no more dentures. So, and for people just tuning in, they could walk in, so I'm clear on this, with no teeth on the day of the procedure.
Yes.
And they could walk out with a full arch of teeth on the upper and lower that day.
That's exactly right.
that
Or
right?
they can walk in with teeth that are failing and bad.
That have to come out.
That have to come out. And they can get them removed and get the implants and the new teeth and walk out just like the one who's been in a denture.
Same
deal.
day.
Same deal.
And that's what you teach
Yes.
other dentists all over the country.
Yes.
Is that why you're here in California, by the way?
Yes, it is.
To lecture?
Yes, it is.
Helping doctors?
Yes,
Okay,
it
good.
is.
You brought photos.
I did. And these are like my pride and joy. And of course, these are only a few examples, but you want me to tell you about these people?
Let's take a look.
This first lady is just a beautiful lady. So she comes in to see me. She's active in her church. Her husband's involved teaching the Bible to other pastors. She teaches Bible studies to women, and she's been proud of her mouth all her life. She's a pretty lady. But all of a sudden she realizes, she gets told she's going to lose all her teeth because they're rotting off right at the gum line. And she's been to the dentist. She's been maintaining her mouth. She's got beautiful hygiene. But Randy, she had dry mouth. Dry mouth is a growing epidemic that's becoming bigger and bigger. It can happen to you because of medications you take, because of autoimmune effects, or the hormonal effects of aging in women in particular, but guys too. So this is her. So picture this lady. She's not old. She's a young woman.
So she's headed for a denture.
She's headed for dentures, and she's devastated. And she's fearful about the procedure as well. And so she comes in, and we take all of her teeth out. She believes in me and her dentist. We're going to team approach. I've got a great dentist to work with, and he does a great job. Just, Randy,
Wow.
Look at the post-op on that. Look at the after, and look at the artistry that this dentist did, how the edge of those upper teeth follow the curvature of the lower lip, and how she shows just a beautiful amount of teeth and gum tissue. And look at the transformation in her self-image as well. She was pretty before. She's dangerous now. She's gorgeous.
Yes.
Big change. And we didn't tell her to make herself up or anything.
She also looks more sophisticated.
Yes, and look at her. Look at how relaxed she is, how confident she is.
She looks younger, by the way.
She looks younger.
I'm not trying
Beautiful
to side with
result.
you, by the way, but it's true. I mean, this really
true.
is a nice.
It's true. Absolute
And so if she didn't
transformation.
see you, she probably would have been wearing a denture somewhere.
Or someone like me.
Okay. Okay, good.
I'm not saying I'm the only guy, but it's good. She's happy she saw me. I'll tell you that. Okay, so here's the next patient. This happens to be a male. Once again, he's young, really young, and he's involved in an accident. Snaps off his front teeth, devastating injuries to his teeth, so much so that the dentist said it's not fixable. We got to get him out. He's facing a denture. He's devastated by that. And then the dentist says, I know a guy that can help.
Dr.
I
Schwarz,
know
let me
a guy.
guess.
I know a guy.
Okay.
And he walks out with permanent teeth that day. Thrilled, happy.
What's a good looking smile, too?
Isn't it though? Transformation. I mean, and he likes his teeth better than they were before the accident.
Yeah.
So the next one, another fellow. This is a Catholic priest, a father, and his teeth just progressively broke down, and he was just worried sick. He loves his work. He loves his work, and he was worried it was going to be career threatening.
Do they
if he had to
not
wear a
smile
denture.
because of this? Like I'm noticing here.
No.
I mean, is this a person that like tries not to smile?
You know what happens is it happens sort of chronically and slowly.
So it's more than just teeth.
more than
Like
just
when you
teeth.
give them their teeth back, you're giving them their self-confidence
You're
back.
giving them their self-confidence back, and it's transforming, and you can see it, and you saw it.
Yeah, look
You
at this
caught it.
after. I mean, that's different.
The way he smiles.
Big difference.
Look at this lady. Now here's a lady.
Oh boy,
Well, people like this. This lady.
because that's got to be unusual.
It is unusual, but they're everywhere. The world's full of them. You don't see it because they don't smile. They hide those teeth, you know? And, you know, Randy, I'll be honest with you. I lost a tooth the other day. I snapped it off. And I'm wearing an Essex retainer right now. You probably noticed my little lisp. It's a pain in the neck. This morning I went to eat, and I had to take it out in the restaurant, and I kind of did so trying to hide, and the tooth fell out. Next thing I know, I'm crawling under the table looking for it. I need an implant. You know, I couldn't get it in the same day because my anatomy didn't allow it. But it's a pain in the neck dealing with removable appliances, whether it's for one tooth or a denture. And so this lady, she's taken care of her children all her life and neglected herself. But her family said, Mom, and her husband said, honey, you got to do something. And so look, we take care of her, upper and lower fixed, full arch, and it's transforming. Her daughter says that it's amazing the difference in her.
And they could eat like broccoli or
They can eat
chew
whatever
pizza. It
they
doesn't matter.
want. Whatever,
Popcorn?
Whatever you can eat, they can eat.
Okay.
All right.
Okay. And we're short on time, so we'll kind of have time for a couple more. This is nice.
A beautiful lady before and after. She, once again, dry mouth, wiping her teeth out, and she couldn't bear the thought of a full denture, so she ends up with fixed teeth.
So
on
this
implants.
after, by the way, because it looks like porcelain veneers, this is that all on four implants,
That's what it is.
fixed set of teeth.
Beautiful, beautiful set of teeth,
Interesting.
gum tissue. Here's a lady, heartbreaking story. Her husband died. She was depressed. She was in a denture, but even Stickum wouldn't hold it anymore. And there she is now after she got her all on four and fixed teeth, and she's dating, and she's excited, and her depression's gone, and it's totally transforming. Here's a gentleman told, like so many, that he couldn't be helped because he didn't have enough bone. And he just needed
So this
to
is
find,
the after
That's the
shot.
after, and he just needed somebody
So
with
another
experience.
dentist said, you don't have enough bone for dental implants.
That's right. And this lady's an example of someone else who was told that she couldn't be helped. And she went from office to office, and she kept being told,
Because
"We
what? She
can't
didn't
help
want
you."
a denture.
Well,
she wanted dental
she did want dentures. She'd worn them for so long, her bone was gone. She had no bone left to wear dentures. She couldn't.
Oh, she couldn't even wear dentures.
She couldn't even wear dentures, and on top of that, she had lichen planus causing her mouth to be sore. So dentures caused her too much pain. She was without
So
teeth.
what'd you do? What'd you do?
I helped her. I helped her with my war chest.
Fixed set of teeth?
Fixed set of teeth, top and bottom.
So what
and
are-
she's just now learning to re-smile.
This is
And
very
it's
nice.
transforming.
So what is it you're doing? And we are short on time, but why are you able to do it and a lot of guys can't? I guess that's what you teach on the road.
Yes,
other dentists.
Randy, it's about years and years of experience and knowing all the different tools that are out there. And there are many surgeons around the world like me, many of them, outstanding surgeons. And it's just a matter of going to training courses, learning new techniques, and then doing them and having the experience.
Can they go to you first? I mean, you're the specialist as an oral surgeon. They can go to you, and if they don't have a dentist, they're out of the system, you will connect them with the general dentist to team
Oh,
up
yes,
and get
absolutely.
this done.
Yeah, absolutely. They don't have to be referred to me by a dentist. Most of my patients are. But many come directly, you know, especially from out of the city.
How old can you be to get this done? Like, what's your oldest patient?
Oh, gosh, Randy, I've got many patients in the 90s, and I would say 80s may be my number one patient.
But 90 years old, are they more likely to fall out at 90 years old, the dental implant?
No, not at all.
Okay.
Not at all. Not at all. They do.
Why would a
great.
90-year-old want to do this?
Randy, you know what? You're never too old to be able to enjoy life more.
Okay.
And I'm telling you, a denture, especially a loose one that's been in there for years, can make you miserable. And it's to transform your life. Are you kidding me? The older you get, the more important it becomes, not the less.
But I know some denture wearers. They never complain about anything. Are you saying that all denture wearers are not happy?
No, I'm not.
Okay.
You know what? I've seen a few guys in particular male patients, that just like my dad. My dad could ride a horse because he started from the time he was a little kid, and he would never bounce on that horse. It was like he was glued to that horse. Well, I know some men that seem to be able to control a denture like that. They've got invariably a huge ridge of bone and thick pad of gum tissue, and they're just tough hombres that just make the best of anything, and they're glad to stay out of that dental office.
Okay.
So they don't need me, but there are not very many like that. Most people with a denture like me trying to ride a horse, I bounced up and down. You could see daylight between my butt and the back of that saddle, all the way across. And the next day I could hardly walk. I'm so sore. That's the way it is for most denture wearers. Okay, putting implants in that bone is like sticking me directly to that horse's backbone, where he can't make me move no matter what he does. He can't buck me off. So that's denture.
So do it. So you're not too old. Now, what about the people that they've been told their teeth have to go? If you have bad gums, how are the implants going to get in there and stay?
Well, I mean, most
bad gums.
Yeah, most of these people losing their teeth have bad gums and bad bone. But the system plans around that.
So you clean up that infection, the gum disease.
Well, the infection's gone when the teeth are gone. That's number one. But number two, the teeth are going to depend on the implants, not the gum and the bone.
All right. Good. Now, final message. Somebody watching this, they're wearing a denture, or they're headed for a denture, and they're still afraid. They're going, I don't know. What do you say to them?
Find yourself a good team. Find yourself a good surgeon who can sedate you, and I guarantee you will not be disappointed.
And they could go to you. They could ask to see you.
Sure.
Because I know you have a team there. We're out of time. Final message to the person watching this. They're either wearing a denture or they're headed to a denture, but they're still afraid. And maybe they're skeptical that in one afternoon they could get this all done. What do you say to them?
Well, what I do is I just invite people in, come in, let me talk to you, and let me visit with you. But at the end of that appointment, what I tell them is, look, I'm not going to tell you that we don't have failures now and then. It happens every now and then. But I'll guarantee you that we'll stand behind it. We'll make it right. We'll fix it. Problems with implants failing hardly ever happen. When they do, it's not a big issue. And at the end of the day, I guarantee you, you'll be glad you made this decision, and it will be life transforming.
Now, do these people, is this one of those things where they say, I should have done this years ago?
Oh, God. Yes. Yes, especially the older ones who've been saying, I'm okay with the denture. They kick themselves if they didn't come in and enjoy it sooner.
So get it done.
Get it done, absolutely.
All right, I want to thank you for coming on the show. Very good.
I enjoyed it, my
Very
friend.
Good. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.